Purple urine bag syndrome is a rare medical condition in which the urine collection bag and associated tubing exhibit a purple discoloration. This distinct color change arises from the presence of indigo and indirubin pigments. These pigments are derived from the metabolic breakdown of tryptophan, an essential amino acid commonly found in dietary protein. Causes of purple urine bag syndrome. The development of purple urine bag syndrome is closely linked to the presence of urinary tract infections. Specific bacteria residing within the urinary tract possess the capability to convert tryptophan into the characteristic pigments responsible for the purple discoloration. These bacteria produce enzymes, including sulfatase and phosphatase, which play a role in this biochemical conversion process. Risk factors for purple urine bag syndrome. Prolonged use of an indwelling urinary catheter constitutes the most significant risk factor for developing purple urine bag syndrome. Other contributing factors include female gender, chronic constipation, advanced age, and hospitalization. Symptoms of purple urine bag syndrome. The hallmark symptom of purple urine bag syndrome is the readily observable purple discoloration of the urine collection bag and its associated tubing. Additionally, the urine itself may exhibit cloudiness or emit a foul odor. Patients may also present with systemic symptoms, such as fever, nausea, abdominal pain, and a burning sensation during urination, which are indicative of an underlying urinary tract infection. Diagnosis of purple urine bag syndrome. The diagnosis of purple urine bag syndrome is primarily established through visual inspection of the purple color urine bag. Laboratory investigations, including urine analysis, can reveal indicators of infection, such as the presence of white blood cells and bacteria. Urine culture, a microbiological test, aids in identifying the specific bacterial species responsible for the urinary tract infection. Treatment of purple urine bag syndrome. The primary objective in managing purple urine bag syndrome is to effectively treat the underlying urinary tract infection. This typically involves the administration of appropriate antibiotics based on the identified bacterial pathogen. Replacement of the indwelling urinary catheter is essential to eliminate the source of infection and remove the discolored bag. Addressing predisposing risk factors, such as constipation, could prevent recurrence. Prevention of purple urine bag syndrome. Minimizing the duration and frequency of urinary catheterization significantly reduces the risk of purple urine bag syndrome. Strict adherence to proper hygiene practices during catheter care is crucial. Effective management of constipation and maintaining adequate hydration contribute to preventing excessive bacterial proliferation within the urinary tract. Key takeaways. Purple urine bag syndrome, while generally benign in nature, serves as a clinical indicator of an underlying urinary tract infection requiring prompt medical attention. Early identification and appropriate management of this condition can effectively prevent potential complications. Educating patients and their families about purple urine bag syndrome can help alleviate anxiety and promote better understanding of this unusual phenomenon.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.